Hi everyone, my name's Madison Griffiths. Today I'll be presenting my digital consumer health resource about measles and parents with young children. In this scenario, there has been an outbreak of a communicable disease within the community, and as a nurse working in the public health unit, my role was to create a digital consumer resource to help raise awareness and provide education to the community. I chose measles because it is highly contagious viral disease that can spread rapidly during outbreaks, especially in the community settings such as schools, childcare centres, and public spaces. Measles also remains an important public health concern despite the availability of vaccination. According to the Centers for Disease Control and Prevention, in 2024, measles is highly contagious airborne disease that can cause severe complications in young children. The target audience for my resource was parents of young children because children are more vulnerable to complications such as pneumonia and encephalitis, which is brain inflammation. Parents are also responsible for recognizing symptoms early, accessing healthcare, and making decisions about vaccinations. The purpose of my resource was to raise awareness about measles symptoms, prevention, treatment, complications, and the importance of vaccinations using clear and supportive communications during a community outbreak situation. I wanted the information to feel easy to understand and non judgmental because research shows supportive communication can improve trust and understanding around vaccinations. Now that I have explained the goals of my resource and target audience, I'll move on to how I used AI during the research process. To begin my research process, I used generative AI, specifically ChatGPT, to gather initial information about measles. My original prompt asked for information aimed at parents of young children, including symptoms, prevention, treatment, complications, and ideas for a health infographic. The AI explained that measles spreads through coughing, sneezing, and airborne droplets. It also listed common symptoms such as fever, cough, runny nose, red eyes, and a body rash. The AI also explained that vaccination is the main prevention strategy and suggested including public health messages like checking vaccination records and recognizing symptoms early. Another useful feature for ChatGPT suggested communication and design ideas. It recommended using calm, supportive, and factual language instead of fear based messaging. It also suggested using simple headings, family friendly visuals, and short practical messages. However, I also identified limitations in the AI's response. The information was broad, lacked detail, and did not have peer reviewed references or evidence. Some answers required clarification and additional research before they could be safely used in a healthcare education resource. Because of this, I refined my prompt to focus specifically on Australian vaccination recommendations and public health advice. According to immunisations in 2024, children in Australia received the MMR vaccine at 12 months and the MMRV vaccine at 18 months. Although AI gave me a useful starting point, it was important to fact check the information using reliable evidence based sources. I'll now discuss the literature review and how I verified the accuracy of this information. After using AI generated information, I completed a literature review using peer reviewed and authoritative sources. The purpose of this process was to verify the accuracy of AI generated information, identify errors or missing details, and collect up to date evidence to support my final resource. The sources I used included the CDC, World Health Organization, New South Wales Health, the Australian Immunisation Handbook, AIHW, and peer reviewed journal articles. My research confirmed that measles is highly contagious airborne disease and that symptoms can usually appear around 7 to 14 days after exposure. Common symptoms include fever, cough, red watery eyes, runny nose, and a rash spreading across the body. According to the CDC in 2024, measles can lead to severe complications including pneumonia and encephalitis. I also discovered that measles can lead to dehydration, ear infections, and in some cases, death, particularly in children under 5 years old. According to the World Health Organization in 2024, measles remains one of the leading causes of vaccine preventable deaths in children globally. I also research vaccine hesitancy in Australia. According to Wiley and colleagues in 2022, some parents believe vaccines are unnecessary or unsafe, while others prefer holistic parenting approaches. This evidence influenced the tone of my research because I wanted the infographic to remain supportive, respectful, and evidence based rather than judgmental. Overall, this process showed me that AI can be useful for generating ideas, but healthcare information must always be critically evaluated and checked against trusted evidence. After reviewing the evidence and confirming the information was accurate, I then used this research to guide the design and development of my final educational resource. For the design and development stage, I created a one-page educational infographic for parents with young children during a measles outbreak within the community. The infographic included all the required health information, including pathophysiology, diagnosis, prevention, treatment, and possible outcomes or complications. For pathophysiology, I briefly explained how the measles virus enters the body and spreads throughout the respiratory system. For diagnosis, I included common signs and symptoms such as fever, rash, cough, and red watery eyes, along with diagnostic methods like blood tests and throat swabs. For prevention, I focused strongly on vaccination, hygiene, reducing exposure, and staying at home when sick. According to New South Wales Health in 2019, vaccination is the most effective strategy for preventing the spread of measles. For treatment, I explained that there is no direct cure for measles, and the management mainly focuses on supportive care, fluids, rest, and monitoring complications. For outcomes and complications, I included information about pneumonia, encephalitis, dehydration, blindness, and ear infections. The evidence I collected during my literature review strongly influenced both the content and design of the infographic. I used simple wording, short sections, and family friendly visuals so the information would feel accessible and easy to understand for parents. Creating the infographic also helped me reflect on the strengths and limitations of both AI and healthcare communication. I'll finish by discussing my overall reflection and what I've learned from this project. In conclusion, this project taught me a lot about the ethical use of AI in nursing and healthcare education. AI was very useful for brainstorming ideas, organizing information, and generating infographic concepts and improving wording. It helped speed up the early stages of the research process. However, I also learned that AI should never replace evidence based research because information may be incomplete, vague, or missing references. Human judgment, critical thinking, and fact checking are still extremely important in the healthcare practice. One strength of my final resource is that it provides evidence based information in a clear, supportive, and visually engaging way that is appropriate for parents with young children during the community outbreak situation. One limitation is that the infographics only allow a limited amount of information, so some complex medical details had to be simplified to keep the resource easy to read. Overall, this assignment showed me the importance of balancing AI use with ethical nursing practice and evidence based healthcare communication. According to the Australian Immunisation Handbook and the CDC, vaccination remains the safest and most effective way to prevent measles and reduce complications. Thank you for listening.